Hey guys, Dr. Davin Lim, board certified laser dermatologist. Today we'll be talking about acne scarring. As you guys know, this is my specialty, it's my niche, and I'm just going to tell you the secrets in regards to how to find the best doctor for your needs. Look, there's no conflict of interest, I'll tell you this, and this is a fact. I really do appreciate a lot of support from all you guys and all the patients I've seen from everywhere around the world over the last 10 years, especially over the last 3 to 4 years. But I'm here to guide you in regards to how to find the best doctor near where you live for scar revision. The reason being is that I'm inundated with work. Don't get me wrong, I love treating patients, but it just comes to the point where it's just crazy. And that's why I went to the US just a month ago to help, I guess, liaise with some doctors in regards to helping the acne scarring community out there. So the most important thing to realize, is that manual scar revision is gold standard. Everything which you see before me, everything which we have, if you guys see all this, all our lasers, all our equipment, everything from erbium lasers to our 4CO2 lasers to secret, intensive, infinite, name it, E-matrix, RF, all of these lasers, devices, energy devices, these are all secondary to what we do. And people say, what's your branch, what's your clinic? It's not that, it's our hands that actually do the work. So manual scar revision is the best because we actually see the scar, we target the scar, and then we can actually subcise, we can actually break down the scar or use some TCA or just manual methods to break down the scar. And we use the lasers behind us as tools or instruments to help us. So it's not about the laser, it's not about the clinic, it's not about the brand, it's about the scar and how to use the correct methods to revise that particular scar. Okay guys, there are exceptions to the rule. Obviously the exceptions to the rule, you can see that there. For early scars such as this, I use simple methods such as fractional laser resurfacing. And once again, it's not targeted at any scars, but just the region in total. And then you get this kind of result. But we're treating early scars and obviously the exceptions to the rule. And once again, if you're treating early scars, that's scars that are less than 2 to 3 months old, we can use any technique basically that delivers any heat or controlled heating or controlled trauma, and that gives you a really good outcome. So treating old scars are a lot harder, and this is why I'm here talking to you guys. So where do you look? Where do you start? The first thing is this. We can start by actually doing a Google search, but do you really want to actually Google ad when you see a doctor or specialist that Google ads acne scar revision? Probably not. It's like going in for knee surgery or cataracts or what have you, and you just go, oh cool, I'll Google ad that doctor. No, you probably want to go by reputation, and you probably want to go by what the community says. Yeah, reputation really counts, and yeah, you can Google ad, that's great, but you probably, when you hit that button, I'll leave it up to you. Okay, so might not be a good idea. Google search, certainly, but there are 2 resources which I can give you, and these 2 resources will help you in regards to finding your practitioner. Now, the first one is acne.org, right? So acne, that's ACNE.org. This is the best site because I'll tell you why. It's an unbiased site. Doctors are not allowed to go on this site. You'll never find me on this site. But you'll find other experts there who dedicate their entire life. And I mean, they really do dedicate their entire life. And they know more about acne scarring than the average dermatologist. So moderators like BA, for example, on acne.org, ask them a question because there are many moderators over there who can help you. And they do not work for a doctor, they do not work for an organization, even though it's called acne.org, they do not work for that, they're independent advisors. So these people will guide you in regards to what is the best method and who is the best doctor to treat your type of scarring. So that's the first resource, acne.org. Okay, and what I think the network, what they're trying to do is build up a network of doctors around the world, which is what I'm trying to do, is that trying to build up who I know in, for example, the UK, Professor Tony Chu in the UK, Emil Henningsen in Europe. These are all doctors who actually specialize in acne scars. Dr. Rulan, Dr. Novik, all of these guys are excellent doctors. And this will be resonated upon what acne.org has got to say, because these are unbiased reviews by patients who have seen these doctors. Okay, so once again, no conflict of interest. I'm not allowed even on that site. The second site, which used to be really good in my opinion years ago, is something called Real Self. So it's REALSELF, realself.com. Once again, I could say used to be good, because 4 or 5 years ago it used to be board certified specialists, which means plastic surgeons and procedural and surgical dermatologists are only allowed on that site. What's happened over the last 2 years, they've commercialized that site. So nowadays you have dentists, imagine dentists and obstetricians replying to questions on acne scar revision. So look, with all due respect, in my spare time, I don't give anyone advice on root canal therapy nor their cervix. So please guys, don't come in my space, okay? And as out of respect, I don't go into your space, don't come into mine. So patients, and the patients are not to blame, because you have these experts on these sites telling you what to do. So just be careful in regards to this site. Like I said, in 2015, I was really honored to actually be one of the top 100. They call it top 100 because we're the top 1%. So I was voted that in 2015. And this was a vote by both the patients together with the Real Self community. Okay, so really proud in 2015. And once again, I replicated that in 2016. So pretty proud to do that 2 years in a row. And come 2017, which was last year, got the same award. Top 100, top 1% of all specialists. I've kept it in the wrapper. Okay. Real Self, thank you very much for acknowledging my contribution. But please, in my opinion, you know, with the patients out there who are really seeking for help in regards to acne scar revision, that's why I keep this in a wrapper still. Thanks for the award, but you know, it's please keep your standards high, right, rather than actually go for a site with financial gain. So you can ask questions on Real Self. I usually do answer most of the acne scar questions if I deem them appropriate. And you'll find guys like Jason Emmer, who's on that site as well, Dr. Novik, who's active on that site. And generally all of these specialists, there's one thing in common. We like to use manual methods. So we're the guys that actually do the subcision. We're the ones that are using the TCA. We're the ones that are using the filler. So imagine a dermatologist can't fill, should not be actually revising scars, because for atrophic scars, you've got two choices. You've got fat grafting or basically a filler. So all of these specialists who are active on these sites will contribute to it. Okay, but just be very careful as well. Look at the reviews and but once again, cross-reference with other sites like acne.org. So remember guys, it's the manual method of scar revision, right? It's not the laser. It's not the laser at all. There's so much confusion with things, and I'll show you this dissection which I just did. How can, in your mind, if you have a look at this, the way I'm looking at acne scarring and trying to go back to basics, is this. I think the industry itself should take a long, hard look as to the research they've done over the last decade, rather than trying to sell machines. Yeah, I still need my machines. I still need these tools. These are actual tools which I need on a daily basis to help me with my hands, my eyes, how I feel for the scars, use an appropriate method. And if I can't, I'll pick up a device of choice to actually revise that scar. But I think we should actually go back to basics. The industry really needs to go back to basics. Have a look at why scars form. Where are the scars, right? Why do they form? Where's the location, and what's the best way to target, rather than saying, hey, you know, we've got a laser that can treat scars, or we've got Infinity, or we've got Intensive, or we've got insulated microneedling, and bagging out one company to the other. We've got to go back to basics and look at the research behind as to where the scars are, how they form, what is the pathology behind that, and then go from there, rather than actually sell a device. Every single year I learn something new. I come up with a new procedure every 6 months. I'll review a device, for example, and go, hey, you know, that might not be the best way to treat a scar. Years ago, we used to use fully ablative lasers, and then it went to fractional lasers. Now it's gone to RF microneedling. So where's the next trend? Guys, it's you can see it's actually trending. But what will never actually go out of fashion is old-fashioned scar revision using manual methods, because we're actually targeting each scar. We're finding the scars with our touch, with the feel. Okay, so remember, it's not a branch, it's not a device. It's just old-fashioned touch, and it's scar by scar, and that's how we get the good results. That's how we actually get the results of you see the before and the afters. But there are, once again, the exceptions to the rule. For example, like this. If you have scars which lie in the same plane and you use a resurfacing laser, you can get excellent results. So don't get me wrong, I'm not saying that lasers are out. I mean, you can see I'm using them day in, day out. Remember, I'm just using these as tools. So just to summarize to you guys out there, like I said, I'm sorry, I apologize to all the moderators on acne.org. If you go to the scar section, they include, I think it's one called Cirrus Lee or something. But anyway, to Cirrus, to BA especially, he has done an amazing job. And I'm sorry to give you more work, but if you guys can ask him in regards to what is the best procedures, if you guys can post on Real Self, I will answer your questions, okay? I cannot, and this is something which you must understand, I cannot give you an accurate diagnosis because touch is so important. There's something called subdermal fibrosis, which is basically scars which are really thick. You can't see them, you can feel them. So when you see me in person and when I actually examine your scars, you can see I take 3-4 minutes. I use angle lighting. I'm there looking at all different angles, throwing light from different directions. But most importantly, you'll see me touch your scars, right? Very gentle touch to understand how thick the scars are, right? Because this gives me an understanding of how difficult my job's going to be. Okay, so that's something I cannot do on the photograph, and neither can the moderators on acne.org. We can just give you the right direction, but we cannot give you the exact plan. And once again, with scar revision, it's a medical procedure, so there's marked variability in the outcomes. Do not take this as a cosmetic procedure. It's a medical procedure. Okay, so it's not cosmetic. Certainly, if you're removing hair, that's cosmetic. If you're looking at frown lines or fillers, that's cosmetic. But scar revision, there's half of it is physical and the other half is emotional and psychological. So don't take it as a cosmetic treatment. And I despise people for actually taking it as a cosmetic treatment, because you're treating real individuals with serious physical problems out there. Okay, so guys, thanks very much for watching this rather serious video. I usually do entertaining videos with a joke or two, but when it comes to the passion and what I do, I take this very seriously, extremely seriously. So for more hints, like I said, those are the 2 hints I can give you, okay? And I'm happy to answer your questions. Just post them up on Real Self. And like I said, if you want an independent review, the moderators at acne.org can help. Guys, if you like this video, please like. If you want to have your comments, comment below. If you know any doctors who can help me in regards to scar revision anywhere in the world, could you please put down below, because the patients really do need your help, and so do I, because man, I'm like so exhausted from helping you guys, and it'll be a great help, and I can't thank you enough if you can actually give me a name of a couple of doctors who can actually do really good work. Okay, it'd be much appreciated. Guys, one new video every week. Please subscribe, and I'll see you again next time. Bye for now. A big shout out to the thousands of patients who have seen me both nationally and internationally from all around the world. Also, a big thank you to BA and all the moderators on acne.org. And once again, all my colleagues, my surgical colleagues in the US for helping me at realself.com. Thanks once again, guys.